It's really hard because the people who raise their hand and want to do a testimonial for a drug company typically are the really great responders. And so it's hard because we don't want to diminish their experience and their positive outcome. That's great and that's really true, but that's not necessarily going to meet the standards of promotional claim substantiation, what they want to say about the product. Hi, everyone. We're back. This is Virginia and Jason from Compliance Forward. This is the Promotional Intelligence Podcast. And we are here with a quick late breaker. OPDP issued 2 letters last week, 2 untitled letters. They were posted on Tuesday, July 22nd. One was to Sanofi for BEYFORTUS. These were 2 HCP emails about their RSV treatment for infants. We're going to talk about their indication placement. And the second was for Viatris for their TOBI PODHALER for cystic fibrosis. This is a patient video from the caregiver point of view. So let's dive in. This will be quick. All right, take it away, Jason.
All right, so we'll start with the BEYFORTUS letter. And as you said, Virginia, this was issued for 2 HCP-directed emails. And the letter starts off by highlighting the presentations where the email describes the indication as RSV disease in infants, and then they go and they highlight all of the subsequent use of RSV disease for infants. And the issue that the agency cites here is that they call out the fact that the indication is for RSV in lower respiratory tract disease, so specific to the lower respiratory tract. And they suggest that this is misleading because it suggests the use of BEYFORTUS for the general prevention of RSV, including both upper and lower respiratory tract disease. So we can see here that they've underlined specifically the section of the indication for RSV for lower respiratory tract disease. And if we switch over to one of the emails that was posted, this is one of 2 emails that they posted along with the untitled letter, we can see where the company is using RSV throughout their promotional piece. So here, the headline starts with help prevent RSV disease in infants. And then we see RSV disease here, RSV disease here, and throughout the email. And about halfway down through the email is when we finally see RSV LRTI for lower respiratory tract infection, and then the indication and contraindication. So this is a little bit different from Sucrade that we saw a few weeks ago. In this case, we do have the indication and safety information integrated into the email, but according to the FDA, the indication summary does not fully characterize the specifics of the indication. In this case, they're saying that they've omitted the lower respiratory tract component of the indication. So Virginia, what do you think about that?
Well, we've talked about this a lot. We kind of went over the letter over and over again, kind of like wondering if we're missing something. I personally feel that this letter is not violative. I don't know the space very well, but I, in my experience, would be comfortable approving a letter that had partial indication up front and then the full indication nestled in the body of the email, not even at the bottom. So I feel like I was left scratching my head. This one's a little bit of a head scratcher, but it's a letter, so we need to learn from it. And, honestly, I'm rethinking a little bit about how I apply my guidance for how to take out a partial indication and present it earlier in the ad or the website or wherever, and then have the full indication below. So this is something I'm taking back to my teams now as a learning. It's different. It's different than anything I've seen enforced upon in the past. I don't really think it's a public health risk the way it's presented, but we have the letter in hand, so we're going to work with it. But that's my opinion is, this seems like a little bit of a stretch to write an untitled letter for this presentation of indication. But full disclosure, I don't know the space very well, so maybe the lower risk infection is really critical to get up front. So we'll leave it to Sanofi to figure that part out. But we're just looking at it from the outside. But those are my thoughts. I mean, it's a short letter. There's no safety information cited. Just I guess we'll call it quote unquote broadening of indication with just the RSV in infants without the lower respiratory tract. But those are my thoughts. Anything you want to add?
No, yeah, I had a little difficulty trying to suss out what what the underlying issue was. And, I went back to where they underlined the lower respiratory tract infection in the indication in the middle paragraph in that letter. And my read is that if Sanofi had included LRTI, of course, spell it out in the first use, but then use that LRTI throughout every mention of RSV disease, they may have been okay. But to be honest, I'm not 100% sure. The fact that they also called out the placement of the indication in the contra, perhaps they wanted that indication revealed, the full indication revealed higher up in the email, but I'm just not sure. And I think that that's something that, Sanofi will hash out with FDA during the cleanup process.
Absolutely. I want to be a fly on that wall. All right. All right. Next up, we've got BEYFORTUS with the TOBI PODHALER for cystic fibrosis. This is a video. This product comes with a pretty complicated step-by-step instructions for use, and that's going to play into the enforcement here. So let's walk through it.
Yeah, so as Virginia said, this entitled letter is directed at a patient and caregiver testimonial. So here in the first part, the FDA is calling out a couple of presentations. In one video, the patient has this voiceover where they say that they can use TOBI PODHALER on the way to school in the car. And then the parent states in this video that they can use it anywhere. They can use it on vacation. They can use it in the car. They can use it while running out the door on the way to school. And the agency calls attention to the instructions for use here. So the IFU has 23 steps in it, and it includes several very detailed steps for how to use the product. They pull some excerpts here from the IFU. They specifically say you have to wash your hands, you have to set the lid aside, you have to set the mouthpiece aside on a clean, dry surface. That dry surface is really important. At one step in the process, you have to ensure that the capsule is empty. So you have to hold the capsule up to the light to make sure that the powder has been fully discharged. If it isn't, you have to put it back in and follow additional steps. And then finally, the dosing requires 4 full capsules. The full dosage requires 4 full capsules. So you have to repeat steps 5 through 17. They say 3 more times here. It's a total of 4 times to take a full dose of the product. So the agency is really calling attention to the instructions for use here and calling out the fact that there's a number of steps that have to be followed. Also, what's really important to call out here is that they call attention to the fact that the package should only be opened one at a time. So the package has 4 capsules in it. You should only open 1 capsule at a time. And they also call out attention to the fact that you have to keep the PODHALER dry. And that's because any exposure to moisture could result in a suboptimal dose. So it's a combination of keeping the product dry during the use of the product, but also the multi-step process here in the instruction for use. So Virginia, what do you think about that?
This one I really agree with. I think that, in general, if a product has an IFU for instructions for use, we need to pay attention to that. That's official labeling. And that's not typically the type of product you're going to want to be making a lot of heavy duty convenience claims. And so, having this video that clearly shows them dashing around and, not really taking heed to the instructions is contradictory to how the product is supposed to be administered. And that could result, like the letter said, in suboptimal dosing. So I think that this one makes a lot of sense. And I think it's a good reminder that if the product has an IFU, we need to look at that as well when we're promoting and making claims about dosing or convenience, for sure.
Yeah, I agree. And I think too, OPDP is always going to take a look at patient and caregiver testimonials, especially those in a promotional setting. So it's important to keep in mind that any kind of these testimonials that are presented in a promotional setting, they do still have to conform to the label. They might be the individual experience of the patient or the caregiver, but anytime these are used in a promotional setting, we have to ensure that they do align with the label.
Absolutely. I don't know if these were real patients, if these were actors. I'd have to go back and check, but I've worked a lot and I'm currently working on patient testimonials with actual patients. And it's really hard because the people who raise their hand and want to do a testimonial for a drug company typically are the really great responders. And so it's hard because we don't want to diminish their experience and their positive outcome. That's great and that's really true, but that's not necessarily going to meet the standards of promotional claim substantiation, what they want to say about the product. Literally heard the word miracle before. So, it's hard because we want them to feel good about their results and that they've done a great thing and they're very proud to be speaking on behalf of the company. Oftentimes they're not even paid, but the rules are the rules. And so the rules of promotion apply, whether it's coming out of a patient's mouth or if it's on a website. So just a good reminder. I think this letter is actually a really good reminder for us. And again, looking at the IFU, making sure that we're accurately characterizing the steps that you have to do to administer the product. All right. Well, we'll see what comes next. OPDP is keeping us very busy, but we're in uncharted territory here with the amount of letters we're seeing coming out. So we're trying to keep up with it. I hope you guys find this interesting. If you like what we're doing, follow us on YouTube at Compliance Forward. Thank you so much.